Are you on Medicare? Are you worried about Medicare Open Enrollment? In this video, we'll share 5 tips on navigating the open enrollment process to make sure you have the health coverage you need in 2024. Let's get started. Hi, I'm Dr. Tim Coetzee. I'm the National MS Society's Chief Advocacy Services and Science Officer. Today, I'm here to introduce the National MS Society's Learning Series. In this episode, we're going to cover 5 tips on tackling the Medicare Open Enrollment process. I'm here with my colleague, Nicole Vasquez, who's one of our experts on Medicare. Welcome, Nicole.
Hi, I'm so excited to be here and get these tips out to everyone.
All right, well, let's start at the very beginning. Nicole, what is the Medicare Open Enrollment process?
Medicare Open Enrollment is a window that opens up each year in the fall for anyone who already has Medicare to use that to make changes to the coverage that they're going to get the following year. And you can make changes during this period of time to your Medicare Part D, your drug plans, or your Medicare Advantage plans.
Got it. So this obviously applies to somebody who already has Medicare, but
Mhm.
does it also apply to somebody who is new to Medicare?
Actually, people who are new to Medicare get what is called their initial enrollment period, and that is 7 months uh, during their first a bit of time on Medicare. And so that window is actually more like a barn door. And so people who are new to Medicare have a lot more time to make those decisions on their initial choices. And then after that, they'll get the opportunity for open enrollment every fall.
Got it. Got it. Great. So that set the foundation. So now let's get to our 5 tips. The first tip is to know your coverage. So Nicole, could you unpack that and what does it mean to know your coverage?
Right, right. Well, to decide if you need a change in your coverage, it's important to know or understand what your coverage was this past year. Uh, that will help you to be able to tell what did or didn't work. And there are so many different types of Medicare coverage.
I see. It sounds like there's quite a few pieces to this Medicare puzzle and quite a bit of terminology.
Yeah, it can be confusing and really complicated. So we don't have time to really go into the different terms and the different pieces of the Medicare puzzle today, but we are going to follow up with another series that dives into all that information.
Got it. Got it. I'm sure our audience will be looking forward to that. So let's tackle our second tip, which is to pay attention to dates. This sounds pretty simple, but I suspect it's not as simple as somebody might think.
No, so the dates that we want people to pay attention to is when Medicare open enrollment starts on October 15th every year, and it ends at midnight on December 7th. Any changes you make during that time go into effect for January 1st of that next year. And I know it sounds like a long amount of time. You've got over a month to look at those changes, but that's a busy time of year. And, that many weeks can go by pretty quick. So it's really important to pay attention to where we are in that open enrollment period to make sure that you have the opportunity to make an informed choice.
I see. And so obviously, you're emphasizing not to miss the dates. So what happens if you miss those dates?
Well, at best case scenario, your coverage for last year was good coverage and it worked well for you. And what will happen is that coverage will just roll over again to the next year. Uh, and then you'll have that same coverage for the following year with no changes. Worst case scenario, your coverage wasn't working for you, or the plan made changes in their coverage, and that's going to make an impact to your access to providers or prescriptions or costs for the entire next year.
I see. So really super important to pay attention to the October 15th date when things open and the December 7th deadline when things close.
Yep, yep.
Uh, So let's get to our third tip, which is to ask questions. And this sounds pretty broad, but perhaps Nicole, walk us through why it's so important to ask questions.
Right, right. Uh, we don't know what we don't know, right? And so we want to make sure that people aren't ashamed to maybe ask what they feel like should be a simple question. Just because something existed in your coverage last year doesn't mean that it's going to carry over to the next year. So it's okay to ask your doctors, are you going to take this plan next year? It's okay to ask the plan, are you going to cover these medications again next year? Each plan has a list of medications that they cover from year to year, and that's called a formulary, and that formulary can change. And so I think one of the biggest pieces is to ask questions about any formulary changes or coverage changes that may happen for the next year.
I
We don't
see.
want anybody to be surprised.
Yeah, we definitely want to avoid surprises. And I noticed you're emphasizing that a person's coverage could change. And, I think you mentioned doctors, health plans, formularies. What could change?
So a doctor and a health insurance plan can decide that they're not going to work together again next year. A hospital and a health insurance plan could decide that they're not going to work together next year. And so it's really important that you know those big pieces, but also the little pieces. Maybe your urgent care clinic isn't going to take your health insurance next year. So asking those detailed questions to figure out, what's going to be best for you personally. Are there, deal breakers or priorities in your coverage that are going to make an impact when you get the answers to those questions?
I see. So this is all really super important information, and this could be a confusing time. So this leads us to our fourth tip, which is to go easy on yourself. And that sounds like advice that any one of us can use at any time. But in
Yes.
particular, how does this apply to Medicare Open Enrollment?
Like we talked about before, we've referred to Medicare as a puzzle. We've said it's confusing. It's challenging to be able to look at Medicare, and it's also challenging to try and get your crystal ball out and figure out what you're going to need for coverage in a year. Um, but it we don't want feeling overwhelmed to put a barrier up to people's ability to go ahead and make an informed choice for the next year. And so that is why we want to talk about our last tip, tip number 5.
And so tip number 5 is to ask for help. And so how can the National MS Society help?
Um, that's what we're here for. We don't want you to feel like you have to make a choice out of frustration because you're down to the wire and you still aren't sure about a certain term or what a certain coverage percentage means, right? We don't want a choice to be made that's uninformed and have negative consequences over the long term. So, what we offer is a team, which I'm part of people who are navigators who specialize in health insurance. And what we can do is we can work with you over the phone and look at what your coverage options for Medicare are going to look like next year and see if it's something that you want to move forward with or you want to explore other options. Each state also has a health insurance assistance program that specializes in Medicare and can help you look at open enrollment options too. And then also, there are health insurance agents out there that specialize in Medicare and selling those policies.
So really to underscore, there's a lot of choices. We're here to help at the National MS Society. And so how can someone talk to somebody from the Benefits and Employment team to get help with their Medicare enrollment?
Yep. Uh, the easiest way is to call the 1-800 number. You can also email. We also have a chat feature on our website. So if you go to nationalmssociety.org, you can go to the chat and request a way to help. But easiest way is to call the 1-800 number and ask to talk to one of us.
That's terrific. And so to recap, first off, pay attention to dates. You don't want to miss your chance to take control of your coverage. Don't also assume that what you had last year can't get better or won't change. It's really super important to ask questions, check the benefits just to make sure. Um, it's also okay to feel intimidated, frustrated. Nobody has a crystal ball, but we are all here to help you make an informed choice, and we have a team of experts like Nicole who are here to help you make an informed choice about your Medicare open enrollment for 2024. And if this video has added value, let us know by liking it and sharing it with a friend or family member who may also be worried about their Medicare coverage. We're all in this together, and we are here to help because together we are stronger.